I'm going to go ahead and get started. I know our team that's helping out with the virtual event will keep admitting individuals as they join. I want to thank you all for joining us for our 4th annual Women United Disruptive Dialogue. My name is Melissa Summers. I'm the Director of Donor Relations and have the privilege of working with our donors and our staff that work in this area of Women United in our affinity group. It is with profound respect that we acknowledge that United Way East Ontario offices, located in Ottawa, operate on the unceded and unsurrendered territory of the Anishinaabe Algonquin Nation. Together, today as we gather to explore the epidemic of gender-based violence, may we hold space for the thousands of Indigenous women, girls, and Two-Spirit LGBTQ+ people who have gone missing or who were murdered in Canada, and those who continue to face disproportionate colonial violence, racism, and oppression. As guests on this land, may we walk gently and with respect. As part of today's disruptive dialogue, some of the content addressed by our panelists may be difficult to hear. It is perfectly normal to have strong feelings about the stories and content that we're discussing today. And I hope that if you find yourself upset or troubled by what you hear, please know that you can step aside at any time. Our staff will be sharing a few resources in the chat as well. I'm so pleased to acknowledge our incredible program sponsor and longtime partner of United Way East Ontario, Accenture. Accenture's ongoing support of Women United is a reflection of their corporate commitment to and belief that a culture of equality is a powerful multiplier of innovation. Today, I offer my sincere thanks and gratitude to Accenture, our longtime Women United member and internal champion, Claudia Thompson, and the incredible Accenture Canada staff who have joined us on the virtual event with a viewing experience today. Thanks to your corporate partnership and continued commitment, we are making a difference for women in our community. During last year's Disruptive Dialogue, we explored how advocacy is really in the everyday actions we take, the conversations we engage in, the information we seek to understand, and what we do with it. It is for that reason that the topic we're exploring today feels so important. Women United is about bringing together our time, talent, and treasure to make a difference for vulnerable women and girls across our region. As one of the 4 impact pillars, addressing gender-based violence is a topic that we have sought to shine a light on for the past number of years, especially after seeing the dramatic increase in needs from our community partners during the pandemic. It was very early in the days of the pandemic that we gathered with Women United donors and members to identify an emergency investment to support women who were unsafe at home in Renfrew County, Ottawa, Lanark County, and Prescott-Russell. This year, as part of our investment in community action grants, we saw the highest number of grant proposals submitted that had a focus or that were directly addressing intimate partner violence. Gender-based violence is a chronic issue affecting many people, and more people than many people realize. Every week in Ontario, a woman, child, trans woman, Two-Spirit person, or gender non-conforming person is killed by a man. On September 22nd, 2015, Carol Culleton, Anastasia Kuzik, and Natalie Varmerdam were murdered in a triple femicide in Renfrew County. The coroner's inquest resulted in the 86 recommendations, something to prevent intimate partner violence from escalating to femicide. The recommendations are a roadmap, and today, with the help of our panelists, we will be exploring some of those recommendations in more detail. At United Way, we mobilize the power of community to address complex social issues, but we do not do it alone. We all have a role to play. Understanding and becoming better informed about intimate partner violence is one way we can make a difference. I'm so honored to introduce our panelists who are incredible advocates and leaders leaning into this work to help ensure that everyone has the opportunity to live free from violence. Kirsten Mercer is a feminist lawyer and advocate who served as counsel to end violence against women at Renfrew County and continues to work with individuals and organizations to advance women's equality and human rights. Jade Nauman is a regional director for Renfrew County with United Way East Ontario and a proud member of the End Violence Against Women Renfrew County, EVA. Candice Shaw is the executive director of the Ottawa Rape Crisis Centre, an organization that has been supporting and empowering survivors of gender-based violence for nearly 50 years. And Ariel Trosser is councillor for Somerset Ward, elected in 2022. Prior to joining City Council, Ariel worked in the nonprofit, labour sectors, and as a communications policy and campaign specialist. I'm so happy to welcome you all as panelists today, and I'm looking forward to the conversation. I'm going to turn it right over to you, and I'm looking forward to hearing what you have to say. Thank you.
Thank you, Melissa. It's my privilege and honor to kickstart our conversation today with the discussions around some of the 86 recommendations that were drawn from the KCW Renfrew County Femicide Inquest. And today we're going to start with recommendation number 1, our thought starter to begin the conversation. Declaring intimate partner violence an epidemic is essential to tackle the problem comprehensively, provide support to those affected, and prevent further instances of gender-based violence and femicide. And our question today for our panelists to consider: why is this recommendation important for women and girls in our region? Why is the language of this recommendation important? Declaring femicide as an epidemic is an essential step towards eradicating and addressing femicide, intimate partner violence, and gender-based violence, calling it out for what it is. We have to see it and name it to change it. We know that in Canada, every 48 hours, one woman, girl, or gender diverse person is murdered. We know that last year here in the province of Ontario, 52 women were taken from us in 52 weeks. We are seeing the highest levels of reported violence since 2017. Intimate partner violence and gender-based violence are deeply rooted social issues, impacting every thread of the fabric of society. Every person deserves to live a life free from violence, a fundamental human right. Declaring femicide as an epidemic is important for those impacted by violence. It's a reminder that you are not alone, that this is not your fault, and that there are help and resources available. Refusing to address the crisis levels of violence in our communities, in particular, our rural and remote rural communities, where the context of violence is uniquely intersectional, only furthers to reinforce victim-blaming mentality and the incorrect and misguided concepts that intimate partner violence and femicide is not a priority for those that are in positions of power and policymakers. This is a community-wide, society-wide public health crisis that needs to be addressed immediately. We cannot afford to wait one more week. Over 70 municipalities across the province of Ontario have declared and supported recommendation number 1, representing over 70% of the provincial population. Communities are standing up to support those that are impacted by violence. And it's time for those in power to recognize that they can create positive impact. And the 86 recommendations are a roadmap towards that change. I'd like to introduce our next guest speaker, Kirsten Mercer, who has a unique perspective on the recommendations given her work as counsel for End Violence Against Women, Renfrew County, a party of standing in the Renfrew County Femicide Inquest. Kirsten, thank you for joining us today.
Thanks, Jade, and thanks for giving such a good introduction to this set of questions. One of the things that I think is really important to start off our discussion is the idea that this recommendation actually came from the jury. Sometimes recommendations come from the parties, and ultimately the jury decides what they adopt and don't adopt. But this recommendation came from them in their deliberations. And I think that's really important because it reflects the fact that these ordinary citizens of Renfrew County heard all of this evidence and testimony, and this was their language. This was their frame. And I think that really speaks to the post-COVID reality and the understanding that we've come to, which is when something is a public health crisis, we can't address it without a head-on, comprehensive, all of society approach. For a long time, intimate partner violence was seen, and in some places and in some ways continues to be seen, as a problem of the private sphere and something that happens in someone's home, something that is not a social problem that needs to be addressed collectively and in the full light of day. And that was one of the tremendous insights of the Mass Casualty Commission work that also came out just months after the Renfrew recommendations, which was drawing this bright line connection between violence in the so-called private sphere, which should be problematized anyway, and public safety. And this idea that that we really do have to reframe our approach along those lines and understand that the language of the social determinants of health, we have to think about the social determinants of safety. Maybe one last point on this before I move on, which is, I don't think anybody believes that recommendation 1, if we were to check that box, we'd be unfurling the mission accomplished banner. Everybody understands that that's the start of a journey. It's the first step. But if you don't take that first step pointing in the right direction, no matter how many more steps you take, you're not going to get where you need to go. And that's why it's critically important to start our work framed around an understanding of gender-based violence and intimate partner violence as a manifestation of a social problem that can only be fixed through changes in society.
Hi, everybody. I'm Ariel Troster. I'm the City Councillor for Somerset Ward. So I represent the ward in downtown Ottawa, most densely populated, highest rate of poverty. And we do have quite a few shelters for folks experiencing intimate partner violence. And we're also home to the only emergency shelter for women and gender diverse people is in my ward. And in January 2022, I forward for Ottawa City Council to declare intimate partner violence and femicide as epidemics. So I do think we can't solve something unless we name it. I think that's really important. And this was also a matter of following Renfrew County's lead and following the lead of that jury, because I do think it's really, really important. Just to give you some context, as I said, we have only one emergency shelter for women and gender nonconforming people, and it is way over capacity. We also have what we call a physical distancing center that we've added for women at Dempsey Community Center. And so it is fair to assume that our emergency shelter system is filled with women and gender diverse people that are survivors of intimate partner violence, because we know in 2022, Interval House turned away 941 people. So, if they can't get a bed or shelter within the sector that a lot of you work in, they come to city shelters. We also know that 38.1% of female lone parent households are food insecure, which means they're hungry, which is almost double male lone parents households. So from a city perspective, I really think that this declaration is forcing us to take a look at city policies and how they impact survivors and how we make those services safe for women and families and gender diverse people who are leaving intimate partner violence, but also to take a look at public security and public safety from a feminist perspective, from a intersectional perspective. And we'll get into this later, but we've heard loud and clear from women and gender diverse people experiencing intimate partner violence that more policing is not going to stop violence in their homes, and that going through the justice system is an enormously frustrating and often re-traumatizing experience. So I know from my perspective as a counselor, it's definitely motivating me to make sure that our city services are recognizing the real crisis that we're dealing with. And recommendation 1 was just the beginning. Thank you.
Thanks, Ariel. So I think this is kind of where I jump in. So as mentioned, I am the executive director of the Ottawa Rape Crisis Center here in Ottawa. Been around for 50 years. And, as many of us on the front line representing the frontline voices and the voices of our communities, really having to think differently about how we show up and meaningfully impact our community and address the needs, the increasingly complex needs that we're seeing come to us, is front and center. So, when looking at this question, both as a frontline service provider, but also from the vantage point of what isn't working, recognizing the pervasiveness of intimate partner violence as gender-based violence at large and sexual violence therein, and declaring it an epidemic is now more than ever a signal that we need to look to structural changes, that we will be able to have impact on many lives rather than placing emphasis on individual responses to violence and to perpetration. So just as an example, we at the ORCC, we consider responses to many who have experienced violence along a spectrum. And on the one end, we see it as the day-to-day crisis response. So for example, supporting people who have experienced violence. But in the middle of the spectrum, we see responses to violence to help keep people safe. So for example, ensuring that they have access to housing, transportation, practical assistance. While on the other end of the spectrum, we look at responses and interventions at the systemic level. And so this means, confronting colonial legacies, racist policies, sexist discourse across many layers of society. So each of these layered responses are critical, but our sector, by force of necessity, tends to have to focus more on the supports for individuals after violence has been experienced. And that puts a lot of us as the frontline service provider in a cycle of crisis management. There needs to be a greater emphasis placed on keeping people safe and confronting the systemic violence and systemic roots that continue to normalize and perpetuate violence, so that we can break away from this emergency response cycle solely as our focus. You know, the language, so to the question of why is language in this recommendation important? As many folks here have already said, language implies that the broad impact of violence means that we need to have then broad impact of intervention. If we can build momentum here with respect to intimate partner violence, imagine what we can do for critical change across different other forms of violence and for sexual violence and gender violence more broadly.
And, you know, Jade, I thought I'd just jump in and add one more point before we move on to the next question. And really to highlight and celebrate the approach that's been taken in those 70 municipalities across Ontario. You know, it was a bit frustrating when the Ontario government's response to this recommendation was to talk about the fact that intimate partner violence isn't a disease and therefore it shouldn't be declared an epidemic. You know, I think it's important for me to name that. It felt like we weren't having the same conversation. But, you know, to offset that response with the incredible uptake, in a way, it's almost better this way, to be honest, that this recommendation has been picked up by, as you say, now we're well over 70 municipalities across the country. Across the province, and representing, I would guess, over 75% of the people who live in the province live in jurisdictions that have named this as an epidemic. And the thing that I wanted to really make sure to add here is when they've done that, as in Ottawa, and Councillor Troster gets a shout out here for sure, because I know she was very involved in leading around this. They didn't just do that, right? I don't think there's any municipalities that did only that. Most of them also did other things. And in Ontario, one of the issues that was lifted up in their city council process was around housing, but also, and importantly, another recommendation, and I don't think we're going to talk about it today, but I'll just squeeze it in here, which is the importance of including gender-based violence and intimate partner violence in community safety and well-being plans. We know that many jurisdictions have already done that, but many have not. And so in a lot of places, this was a way to start that conversation and reset who sits around that community safety and well-being table, and understanding that we actually need some different people in that conversation. And I know that that's a statutory required process for every jurisdiction in Ontario to have these plans. If we have the right people around those tables, that's a long-term mechanism to make sure that the right conversations are happening about what community safety and well-being looks like, municipality by municipality.
Well said, Kirsten. Thank you so much for that additional input. I think you're framing this conversation in a great way for those that have joined us virtually today. And I think that brings us to the next recommendation. If you'd like to walk us through recommendation number 39.
Yeah, I think I'm going to facilitate this discussion. And recommendation 39 talks about minimizing destabilizing factors, which is a mouthful. And I think we're going to unpack that a little bit together in our discussion. And it's an interesting shift because it talks about minimizing destabilizing factors for perpetrators of intimate partner violence. This was a theme that came across very clearly in the recommendations from the jury. And I don't want to say it's been a shift for the movement to end intimate partner violence or the VAW sector, but I think the realization has been taken up a notch, if I can put it that way, about the need to understand prevention in the very same breath as our response, that we cannot have a situation where we're dedicating better resources to pulling people out of the river and not look upstream to figure out who's throwing them in, you know? And so I think, and I mentioned earlier about the idea of the social determinants of health, and I think that's the social determinants of safety mirror that. And I think that's a helpful frame for us to talk about this idea of destabilizing factors. So the thought starter, I'll just read it here, is when we work to reduce risk factors for IPV perpetrators, issues that are correlated to IPV and remove barriers for survivors, especially in rural areas, we are asserting that preventing IPV is just as important to responding to it. And I think in some might say more important, right? Like, even if we have the greatest response, there has still been harm. And if we can get to a place, and if we're calibrated to the goal of preventing it in the first place, I think that's a better place for all of us. So our question for reflection is, how does this recommendation help to address upstream and downstream impacts of IPV? And
So
sorry, and I was just gonna say, I think Ariel's going to start.
Yeah, I think I'm first on the list. So my perspective is a little different as a city councilor, where we're really focused on meeting people's basic needs. And it's really important to meet those basic needs in a way that is not going to traumatize survivors and that's going to promote real community safety. So I'll tell you, I hear about safety all the time in my neighborhood. We have one of the highest rates of crime in the city, but it's largely what I would call crimes of desperation. We have an incredibly high rate of poverty. Food inflation is through the roof. And right now, I will ask you to guess in your head what the price of a 1-bedroom apartment is in downtown Ottawa right now. It is $2,100 a month, which is obscene. And we have more than 11,000 households on the wait list for rent geared to income housing. So solving the housing crisis, solving the food security crisis is helping to solve the intimate partner violence crisis, because as we all know, people will stay in unsafe situations if they don't think that there'll be a place for them to live or ability to feed themselves and their families, right? So providing those basic needs is really, really important. I've also been recently added to an emergency shelter crisis task force. Our family shelter system is 330% over capacity. We have entire families living in small motel rooms. We are in the process of trying to fix that as quickly as possible. We have a number of balls in the air, but if you can also imagine, you can imagine how your stress level would rise if you're living in one room and with a partner who might be abusive or become abusive because of the absolute pressure of living under those circumstances. So I think it's really important to address those factors and to take a look at the way our services operate. You know, I had a horrendous experience a few months ago sitting with a woman who was leaving a violent situation, who was in absolute hysterical tears because the only place that she could go was an emergency shelter, and she had to be separated from her dog. And she was devastated to have to leave her dog. We were able to find foster for the dog. She was later reunited with the dog. She later found housing. But that was additionally traumatizing to her because there was no space available in intimate partner violence shelters. There was no space available in the one emergency shelter that would allow her to keep her pet, and she had to be separated from it. And it just so happened there was a volunteer service that would foster her dog. But I mean, these are all re-traumatizing factors. You know, and things I hear about in my office all the time are, why isn't there lighting in the dog park? Like, I take my dog there, I don't feel safe. I'm experiencing street harassment from people who might be feeling really unwell or experiencing addiction, but they're still yelling misogynist things at me, and that is really scary. So something else we're doing in Ottawa, you might have heard, is starting this summer in Centertown, which is one of the neighborhoods I represent. We will be launching a new alternative crisis response service. It will be 24 hours a day. It will be 7 days a week, run entirely by a community agency, non-police. The idea is to have an alternative number to call when you are in crisis or you see someone who is in crisis, who is not committing a criminal act, who is not perpetuating violence necessarily. But we're also hoping by having that alternative response, first of all, we'll be able to respond more appropriately to situations where a survivor might be having a mental health challenge. You know, they might be having a really bad day, but they're having that bad day out in public because they don't have shelter. So therefore, this is happening in front of everyone. And then the hope too is that if there is a situation where there's a weapon or something extremely dangerous and police do have to respond, that by taking that workload off their plate, they'll be more available to respond in a situation that's a true emergency. So, you know, we're really, there was a really great report that was put out by the Coalition of Health and Resource Centers called Rethinking Community Safety that I recommend you take a look at, because it really speaks to how community safety, just as you said, Kirsten, we have to have the right people at the table, and it is about so much more than enforcing laws and arresting people if they cause harm. It is about making sure that our services are really there to support people and that we're sending the right person to help you in the right situation. So I think I'll leave it there, but I do think that this recommendation is helping move us as a city forward on providing those alternatives and having a broader conception of safety.
Thanks. And Candace, I wonder if you can help us sort of situate these destabilizing factors. And maybe before we do that, or maybe if you want to do that, help us understand, what those look like. The actual recommendation identifies a bunch of them. So maybe I'll read those because I think it will help us to, Councillor Troster's perspective is excellent. This recommendation talks about destabilizing factors for perpetrators. And so I just want to kind of unpack a bit of that. And then I think, Candace, to have you situate that sort of at a systemic level, I think is really important. So the recommendation says specific consideration should be given to financial instability, housing insecurity, as Councillor Troster just talked about, mental health issues, including addictions, and how these factors and potential solutions are affected by rural realities. So Candace, over to you.
Yeah, thank you so much, Kristen. And Ariel, I think I want to kind of touch back on some of the points that you had made first, and then I'd love to kind of speak to it from what we're seeing at the front line here at the Ottawa Rape Crisis Center. And the draft budget for the city has come out last week. And for the city of Ottawa, from 2024 to 2027, they've allocated $3,490,000 for social services, in contrast to $88,790,000 for police services. So right there, we're looking at about 25 times greater for police services than for social services. And without even getting into the discussion around that, more so just the raw numbers indicate where the emphasis is being placed on response to violence once violence is done, law enforcement, evoking a judicial system and process, as opposed to really investing more in the prevention and responses to violence. But, when we talk about those destabilizing factors, when we talk about housing insecurity, food insecurity, addictions, the folks in our communities who are looking for supports tend to go to us as social services, as community service providers. But when you look at the raw numbers just there, and I'm really, keen to be meeting up with Ariel and a group of folks from our sector, the violence against women sector, tomorrow evening, to go over the draft budget. It's really just an indication that those wraparound supports for our community, there isn't a lot there in terms of core, long-term, multi-year funding to be able to address the complexity of needs that we're seeing and the growing complexity. So Kristen, to answer your question, even just on the violence response end of things as a frontline service provider, whether we get into the perpetrator versus those who have lived experience, for the folks who are coming to us with lived experience, we are seeing increasing acuity on our active caseload. What that means is there's multiple intersections that folks are having to manage, not only their historical experience of sexism, of homophobia, of transphobia, of racism, but then, where it results in homelessness or, food insecurity. And when we look at trying to address one person's experience of violence, for example, when they come to us, if they're not able to access housing or address some of these other concurrent needs, then we can only be so effective in our impact, right? And if all these other service providers are not receiving the funding that they need to be able to do the wonderful work that they're doing to respond in these various capacities, who then can we reach out to as a warm referral when we're trying to build out these networks for the folks who are coming to us for supports? So it just kind of starts to paint a picture that perhaps when we look at our budgets in our respective areas, or when you look at funding initiatives from various levels of government, or when we look at, the corporate social responsibility funding opportunities through the various partners we have here and others, and when we look at, the very progressive funders like United Way Eastern Ontario, for example, and their responsiveness, it's really about ensuring that we put the emphasis on the social networks, the social supports first, and then looking to challenge those responses to violence at structural levels, at prevention levels, and on the response itself. So thank you. Thanks, Kristen.
Thanks, Candace. And Jade, I think maybe we'll turn to you and just maybe if you can help us ground this discussion in the rural reality, which is, which was such a critical facet and lens of the inquest, and talk about Renfrew.
Absolutely. Thank you. I often, when it comes to this particular recommendation, the first thing that pops into my head is a saying that's probably familiar to our panelists today and to those of you that are joining us on the call. The idea that violence is cyclical. We know that to be true. And I also like to think about, for our particular region, we follow the Ottawa River in East Ontario and the communities of Renfrew County, Prescott Russell, Ottawa, and Lanark County. And I often like to think that while we're responding to intimate partner violence and crisis in the communities, we continue to build lifeboats or rafts on the river. And we try to bring on as many folks that are impacted by violence as possible onto an ever shrinking life raft. But if we know that just down the river, closer towards Ottawa as we're leaving Renfrew County, there are speedboats filled with people that are continuing to perpetuate intimate partner violence and femicide in our communities, why do we keep sending them down the river towards that violence? We have a responsibility as a society to ensure that we're not only responding to the crisis, but we're working to prevent it as well. We've got legislation and laws around housing, for example. If we know that there's a particular material that is flammable, we outlaw it. We don't allow homes to be built with it. We need to have the same kind of reflex when it comes to addressing intimate partner violence and looking at prevention as just as important to response, particularly in rural and remote rural communities where access to resources are incredibly limited. Right here in Renfrew County, for example, we're the largest county in the province, largest rural county in the province of Ontario. Geographically, we're larger than the province of PEI, and yet we have no public transportation. We have one women's shelter that is consistently at capacity, and particularly during the pandemic, similar numbers in Lanark County as well. They were turning away hundreds of callers that were looking for help and resources. We need to address affordable housing first and foremost from a housing first perspective to ensure that they have safety and a safe place to go. We need to be ensuring that we're increasing supports across all social services, including mental health and addictions and counseling supports, ensuring that they have access to education, employment, childcare, you name it. There are opportunities and ways to address this, both from a response and prevention perspective, and ensuring that we are investing into programs like PAR program, for example, that's working with perpetrators to address the root causes of why they are committing harm against their intimate partner or family members, for example. And we know this to be true. We have to listen to the experts on the ground, our frontline service providers and our partners that are addressing this day in and day out. And from a funding perspective, when we're talking about rural communities, often, as we know, from a tiered municipal perspective, funding is delivered from a population perspective. We know that funding model does not work in rural and remote rural communities. We're consistently disadvantaged because we don't have the same sort of population density as for example, wards in Ottawa would have. But our budget is unique in the sense that we need increased mileage support, for example. We're traveling hundreds of kilometers up and down Renfrew County. So that needs to be taken into budgetary perspectives as well, recognizing that food inflation, food security are particular issues for communities with remote and rural communities. Food deserts, education deserts, for example, without access to public transportation, youth are relying on school buses. And if parents don't have a vehicle, kids aren't getting into the after-school support programs where we can identify family-based issues if violence is in the home. So we're disadvantaging everyone by continuing to use funding models that aren't reaching out to the rural, remote rural communities and our frontline workers and organizations and agencies across these communities that desperately need to be adequately and stably funded. And I think that brings us into our next recommendation.
Yeah, so I'll be looking at the next recommendation. So that being recommendation number 21, develop a plan for enhanced second stage housing for intimate partner violence survivors. So the thought starter here is enhanced second stage housing not only ensures the safety of intimate partner violence survivors, but also offers them the necessary supports and resources to build their lives. So, it's interesting because I'm always going back to our context here, and I really value Jade, for example, providing that rural contour, because it's so important to take into consideration your context that you're working from. And so for us, it's really Ottawa, and the city's 10-year housing and homelessness plan was launched in 2024 and aimed to achieve the following outcomes by 2024. So in 2014, I should say, it was launched. And so they planned to have no one unsheltered, chronic homelessness is eliminated, and emergency shelter stays are less than 30 days. So, you know, I'm listening to what has already been said till now, and what we as frontline service providers, and I'm sure many folks here with us in this conversation, we know that these have not been met. If anything, we've seen unprecedented rates of folks being unhoused or precariously housed. Even in the update on this report in 2021, they indicate that, you know, who represents those who are not able to access adequate housing. So, for example, Indigenous people represent only 4% of Ottawa's population, but yet are 32% of the people experiencing homelessness in Ottawa. And 42% of the residents have been in foster care or have experience of being in the child welfare system. We also know that the #1 cause for female homelessness in Canada is intimate partner violence, which is, it tells us something. So, you know, from a frontline service provider, when we're looking at, you know, the need for, like, we're dealing with an affordability crisis, housing crisis, and the need for stronger systems and enhanced second stage housing, it gets me thinking from the perspective of sexual violence and gender-based violence as a frontline provider about the even more intense partnership building that's required with the housing sector. If we're thinking that that's the #1 cause for female homelessness in Canada, and we also know that the experience of interpersonal or intimate partner violence is very much linked to homelessness, then how do we coordinate our voices with people who are already advocating for housing and strengthen both our intended outcomes as a service provider addressing violence in our community and those who are looking to reduce or eliminate homelessness in our community? So just looking here, I think I'm going to be passing it over to our second panelist here.
Thank you, Candace. I appreciate your perspective, particularly from that frontline service provider perspective. Coming back to the question, when I think of how do we best plan for and support a strong system of safe and supported and enhanced second stage housing, first of all, we have to ensure that rural communities have second stage housing. The majority of our communities in East Ontario do not have access to those kinds of programs and resources and supports. It's generally more often that we'll be able to fund those things within an urban center perspective. So from a rural community perspective, first and foremost, we need second stage housing, but we also need affordable housing first. As we've spoken about at length already, we know that the affordable housing crisis is directly impacting folks' ability to leave violent homes and find themselves in situations of safety with wraparound holistic supports. So we need to be addressing this from a funding perspective, but it has to be from an all hands on deck approach. We need to be listening to the experts in the field, the frontline service providers who are operating shelters. We need to look at unique models where we are approaching this holistically. We've got mental health, addictions, and counseling support from a trauma-informed perspective built into programs and resources for folks that are able to access second stage housing, building in education and employment supports as well, providing them with an opportunity to move from poverty to possibility, for example, ensuring that affordable childcare is available as well. In particular, when the conversation comes to women and gender diverse folks who have children, they need to access affordable childcare in order to engage in the workforce. And by not investing into those kinds of holistic approaches, we're ensuring that they are disadvantaged in terms of trying to bring themselves out of incredibly traumatic and often life-threatening situations towards building a healthier and safer life for themselves and for their family members. But at this point, I think it's also important to consider that the impact as well from an urban perspective. And for that, I'd appreciate Ariel's thoughts.
Thank you, Jade. So Ottawa has always been a city where we have said we will not turn anyone away. And until now, that's been the case. Our shelters, though they may have been full, have never been overflowing. We've always had a bed for people. We've always been able to say, if you don't want to sleep outside, we have a place for you. Just last week, there were about 40 people sleeping upright in plastic chairs at the Mission in their overflow section because our emergency shelters are completely full right now. As I said, our family shelter is at 330% capacity. And I was just at a launch yesterday that the Ottawa Food Bank did about food insecurity in Ottawa. Food Bank is up 68% since 2019. So to Marianne in the chat, who was talking about the need for other levels of government to step up, you're 100% right. I keep saying my secret agenda is to radicalize people about municipal finance reform, which sounds incredibly nerdy, but here's the reality. Municipalities manage 60% of the infrastructure across Canada. We get between 8 and 9 cents on every tax dollar. Raising property taxes is enormously unpopular and no one wants to do it. And it's actually a very regressive form of taxation because you have seniors, for example, who may still have mortgages on their homes, who have a fixed income. You know, when property taxes go up, it reduces their income. It's very, very challenging. But truly, we end up having to go to the province or the federal government to beg, cap in hand all the time, to deal with these crises that have been downloaded onto municipalities. So because we've always been a city that has said we have a bed for you, we have also become a place that people travel to because they may not have services in their rural community, Jade, like you were mentioning. And also now I have been involved with refugee sponsorship and support for 7 years. I profoundly believe in the need to welcome and support newcomers in our country. But right now we are not receiving federal support, and 70% of the people in their shelter system are newcomers. This is refugees and asylum seekers. And if we want to talk about sexual violence and intimate partner violence, that is what they are often escaping in the countries that they come for. And if you can imagine the trauma of coming from a war-torn country or leaving a country where you're facing homophobic or transphobic oppression and then ending up on a plastic floor, on a plastic chair on the floor in a shelter with a mixed population of traumatized individuals, this is not how we want people to get their start in life. So we need other levels of government to step up. Actually, this week is the Federation of Canadian Municipalities Advocacy Week, and they're advocating for a new municipal growth framework, which again sounds incredibly nerdy, but we just need the resources to be able to help people. The roots of the homelessness crisis in this country is when the federal government 30 years ago pulled out of funding public housing. And it was a slow moving crisis for 3 decades, and now it's a fast moving emergency because there's almost no market rate housing that people who live on ODSP or Ontario Works can afford, that survivors who are leaving marriages or intimate partner or violent situations can afford. So, you know, we're raising the alarm bell as much as we can at a city level because we never want to be a city that says we have to close our doors to you if you're not from here. Like, we want to continue to be a welcoming place. And we want to ensure that, you know, if intimate partner violence shelters are full, that there are city shelters that are responsive and sensitive to survivors and protect people's safety. But there's another notion that I want to question too, is this concept of second stage housing, because I believe that people should be moving from shelter into permanent affordable housing. We have seen examples in BC where people have been in transitional housing that they had to leave and they ended up back on the street homeless again. What we want is permanent affordable housing for people. I fundamentally believe in one of you mentioned housing first principles. You shouldn't have to qualify for the dignity of a permanent home. We know that supportive housing with the right supports works. There's an organization called Options by Town in Ottawa that has a 92% success rate in keeping formerly chronically homeless individuals housed after 2 years. With the right support, anyone can thrive in permanent housing. So I am happy to say that in Ottawa right now, we do have more supportive housing beds than we do shelter beds. That might shift as we have to open more shelter to deal with this crisis that we're dealing with right now. But the goal is to replace shelter with permanent supportive housing. And that would absolutely be a role for the IPV sector. And then if folks don't need that support can be slowly withdrawn, but the housing remains. You're not moving people multiple times because that can be really traumatizing. So that is the vision that I'm pushing for. And you're absolutely right, Candace, about the poor balance in our city budget priorities. And I am about to meet with the mayor this week to demand that we double the capital budget for affordable housing in this budget. And I'm starting to gain a lot of support among council. So we need to show in very concrete ways in this budget where our priorities are. The other thing I'll say too is the non-police crisis response project that I mentioned will be a $3 million a year, 3-year project. Toronto started with a pilot as well, and they are now expanding that across the whole city to make it a permanent alternative crisis response service. And over time, Candace, my hope is that is moving resources that would otherwise go to policing into the community. That is the long-term plan. And the hope is that this will be a pilot, that this will be the beginning of systems change. So we just have to get the pilot launched shortly. I'm very excited about it, but we need good data to drive good decision-making. And we're hoping that that's what we'll get in that scenario. Thanks.
Thanks, Ariel. And I really appreciate your acknowledgement of the different layers of government. And I think it was mentioned, as you had noted in our chat as well. And we can't operate in silos. And in fact, this pulling back of support of social, we talked about federal decisions, even the Ontario government not declaring this an epidemic, and then having to see the uptake from municipal levels, which is strong and powerful, but needs to be coordinated to have lasting long-term advancement. I think it's also important to mention that when you see this retrenchment or pulling back, who is expected to pick up the slack? Often it's those really poorly resourced social supports that, we brought in a service navigator, for example, because that coordination is not happening, right? So it's just those investments that we're having to pull from our very tight budgets to be able to bridge the gaps when others lean out. We are having to lean further in and do more with less. And I think this dovetails nicely into Kristen's discussion about getting those right people at the decision-making tables. So over to you, Kristen.
Thanks, Candace. And I think it might be helpful really hearing what Councillor Trofter was talking about to situate this recommendation in the context of the conversation that we had at the inquest. Because in Renfrew, there is no second stage housing at all. There is an emergency shelter, and then there's whatever exists or more likely doesn't exist in the market in terms of affordable housing. I think that what the jury was telling us with this recommendation is, we know that people, when they first leave a situation of violence, that is an extremely dangerous moment that needs to be very carefully managed, and that high touch, high service time, it doesn't go away altogether, but it may not continue indefinitely. And so what happens if you don't have a next step? And completely agree, obviously everybody should have affordable housing. This is not a debate between second stage housing and affordable housing. This is about moving people out of that high stage crisis mode context into something else that isn't, just a waiting list for an affordable housing space or somebody's couch. We know that that there is still a need for something. And I guess the sector and some of the testimony that we heard at the inquest talked about the value of that, I don't want to say step down service, but a little bit less, it's not the ICU anymore now, right? You need a little bit less in terms of resources, but there's somebody else waiting for that spot who does need that level of intervention, who does need that level of support. And if we don't have anywhere to move you, that person keeps waiting. And that person is remaining in a position of violence and insecurity, and that can't continue. So, there's no debate or daylight between our positions in terms of what the end result needs to be, right? Like we all agree. And I think there's a growing consensus, not that anyone was debating it before, but really understanding of the acuteness of the problem in our country around affordable housing. And I think, that was the intervention that I wanted to make, which is about having the right people around the table. We know that there are conversations happening in every municipality right now and big dollars on the table. around housing spends, right? We know that this is an issue that people are belatedly perhaps, but recognizing and funding. So it's critically important to make sure that we have folks from this sector in those conversations, because there's need there. And that's not an obvious, when you've got your housing developers and the other folks who are often around those tables, it's not typically the case that someone's going, you know what, we should get the shelter here. We should get someone from the shelter into this conversation to talk about how their needs might be also met in this space. And so I think that that's the piece that I wanted to add around having the right people around the table, recognizing the moment for all of the reasons that go far beyond the issues around gender-based violence, the affordability crisis in the country and all of the many ways that we got here. But realizing that there's an opportunity to respond at the same time to the affordable housing crisis and to the needs of the sector, which ultimately it's the same problem, right? It's the same problem of lack of affordable housing, lack of places for people to be that are safe, that they can afford. And so, I think that idea of making sure that we're always asking, like, who else could be in this conversation? That's sort of one of my kind of critical mantras, like, who else should be here at this table? And so I just wanted to kind of add that to this discussion.
That's great. Thank you so much. And, I will just flag one other issue that we're having that I think is sort of low on the radar. People don't understand is a lot of Ottawa community housing, which is not funded to be supportive housing. It doesn't have enough built up support, has a lot of traumatized individuals living in it who are unattended to, which creates lack of safety and discord within these towers where you might have a new refugee who's left a war-torn country who's placed living beside someone from the country they were at war at. You might have a survivor of intimate partner violence living beside, I don't know, somebody who has intense mental health issues and is flying into a rage all the time. So this is something we're also working at, is how we can properly case manage those buildings and get support for the tenants that are living there too, because all of our systems are groaning from the pressure. So it's my turn to facilitate. So the next thought starter is, in order to combat intimate partner violence effectively, we must adequately and stably fund organizations, as you were all saying, providing support services for IPV survivors. The social services sector can't do it alone. This requires an all hands on deck approach. And the question is, if we were to scale up capacity and adequately support immediate needs of survivors and the long-term effects to combat intimate partner violence, what would the ripple effects look like in our communities? So I'll just start by saying yes. I mean, one of my biggest concerns, and you did flag this, Candace, was that if we do move to an alternative response model and we are moving resources out of policing, we want to ensure the people that are on the front lines doing this very traumatizing, difficult work are being compensated appropriately. We have, certainly in the harm reduction sector across Ottawa, across the country, across the world, a lot of burned out people, for example, who may have revived hundreds of people from the brink of death from overdoses, who are experiencing vicarious trauma and making really low wages and on really terrible short-term contracts. That's unacceptable. We can't download community safety work onto already overworked, burned out social service professionals. I am happy to say that when we do launch the alternative crisis service, it will involve set wages that are set by the Guiding Council on Mental Health and Addictions to ensure that those folks are properly paid. But I'll give you a perfect example. We had an example where one of our emergency women's shelter was experiencing a lot of workplace trauma, and there had been violence within the shelter due to all sorts of challenges, and staff were dropping like flies. And so city staff offered to bring in city staff to help relieve the women who were working in that shelter. But the city staff that came in, they were making $10 an hour more than the women working in the shelter who were burning out. It happens time and time again. When we opened our overflow shelters that we called physical distancing centers, the city poached a lot of staff from these women-led organizations because they were making more coming to work for city. So we absolutely need to fix that salary differential. It's really, really important. And something else to say is, if we properly funded organizations like yours, if we properly funded prevention to intimate partner violence, we would save a lot of money. We'd be saving on policing, we'd be saving on emergency room services. We know that solving homelessness is cheaper than allowing it to continue. But one of the challenges, again, you'll hear me talk about jurisdiction, is all of the costs might not be felt on the same balance sheet. So, hospitals are provincial, but EMS is citywide, you know, but if we look at the global cost, we're getting much more value for money to properly fund, you know, women's shelters, intimate partner violence organizations, rape crisis centers, community safety initiatives that help prevent crime before it happens and help survivors navigate the world. So my ripple effect is that we would save money and people would be safer. So those are all very good and important things. Candace, over to you on the issue of what the ripple effect would look like if we actually funded these services properly.
Right. Well, and thanks for that, Ariel. You set it up really nicely. And I want to say, you know, when someone's experiencing interpersonal violence or gender-based violence or sexual violence at large in our community, the first people who are often called are us, the sexual assault centers. You know, we are often the very first responders, and then it's from us that we are having to do a lot of the service navigation or systems navigation, to do the warm referrals to the shelters, to ensure that people are being, you know, supported with access to, you know, to food, to shelter, to, you know, and we as frontline service providers are expected to do more with less. So Ariel, to speak to, you know, you spoke about the salary piece, and I think many of us who are in the front line can understand, in the not-for-profit sector at large, we can understand that, and the schism between publicly funded individuals and being the not-for-profit. I'm sure that all resonates. I will also say that chronic funding stagnation in this sector is a real issue. We all talk about the cost of living and the cost of delivering services on, you know, record highs, but when we don't see a corresponding increase to funding, then we're expected to do at least the same with less. But I would argue that because we're seeing more complexity in terms of the situations facing people who are coming to us for our supports, that they're coming to us not only because they've experienced sexual and gender-based violence, or in this case, intimate partner violence, but they're also facing all these concurrent challenges, then it puts that much more pressure on us as first responders to ensure that they are getting the help they need when they need it in the right order. You know, how can we address the trauma that they've experienced when they're on the streets, or they can't find safe, secure housing, or that they're forced to make decisions to live with partners who may not be safe for them. So this becomes a bigger question of, you know, what are we doing to support the first line of supporters, of community responders like sexual assault centers? It's about core funding. You know, as I mentioned before, we're very fortunate that we have great partnerships with, you know, United Way Eastern Ontario, for example, who is very responsive. But by and large, a lot of our funders are project-based funders. They have, again, not increased their funding. And also the way the funding structures are set up is it encourages almost like a siloing of our sector, where there really needs to be more partnership and integration to facilitate these wraparound supports that are required to address the complexity, increasing complexity that we see in our community. You know, just to speak to a bit more too about what, you know, the blue sky. Ultimately, we want to achieve a society where there isn't violence, and that means that there isn't homelessness, that people are not being left in a cycle of crisis, and that ultimately we as first line supporters are not left in this crisis management stage where we're expected to have band-aid solutions for gaping wounds. Yeah. It's a clear signal that we need to do more robust wraparound supports.
Thank you, Candace. And I'll just say the one thing I haven't mentioned, which is of course huge, is the impact of the overdose crisis and the drug poisoning crisis in our community too. So we're seeing an incredibly high rate of erratic behavior from individuals who, you know, might have been experiencing homelessness or mental health issues or addiction before, but the new poisons in the drug supply are causing a degree of brain damage, a degree of erratic behavior, and a degree of unprovoked violence that we are hearing this from our street involved population too, which makes it even more difficult for folks like you on the front line to be able to respond, which is why we need so much more support. Absolutely. So Kirsten, over to you.
Yeah, you know, I'll just again take us back to the place this recommendation came from. And again, not to speak for the jury, but I think one of the things that came across very clearly at the inquest into the Renfrew femicides was the degree to which those frontline service providers in that community are holding a system together with chewing gum, duct tape, and the sheer force of their spirit. I think the jury really responded to that. And I think there was an honest conversation about some things that we don't really talk about very often, like what they're, not in detail, obviously, or anyone specifically, but like, what does the funding look like for those institutions? And the very clear contrast was drawn with the way, and those institutions, I mean, like women's centers, rape crisis centers, even victim services organizations, and which in many cases are a manifestation or a growth and evolution of the women's movement. And so they've kind of developed in this parallel track to other, if I can call it, social service responses. And there's been a bit of a tension, I think, about, some people talk about the professionalization of that service delivery. But what the jury heard was, this critical work, like life-saving, frontline health and safety work, is being provided by people who, like, 3 of them make about what a police officer makes. And they have no pensions, and they do this work day in and day out. There's no off shift. They're available all the time, and they're holding their communities together, as I said, like with the sheer force of their spirit, and often at great, personal cost, right, in their own lives, in their families' lives. And so I think that the jury really responded to that, and I think, frankly, they were shocked to learn that we fund this work in this way. We just talked about project funding, and what that means is, like, you apply for a grant, and you have to compete for the grant, you have to report on the grant throughout the grant's life cycle, and then at the end of the grant, there's sort of an implicit suggestion that maybe, like, the project is finished. As opposed to understanding, and again, I will stand up and applaud the day that this work is done, don't get me wrong, but the idea that this work can be done on the life cycle of building a gazebo in your park, that we fund this critical public service in the same way that we fund, building a skating rink, like, that's just not the nature of this work. And we have to stop doing that, because again, like, we all want this to come to a place where the services are not needed. But until we get there, this is not different than, having ambulances to take people to the hospital, having doctors to treat people, having schools. This is a vital service, having police officers to respond in crisis, or alternative responses, such as the one that Councillor Trotzer described. And I think, until we get to that place, we're going to have a fundamental problem where this work is always going to be under-resourced, and people who should be spending their time creating safety plans, helping people navigate the system, responding to the crisis that is in front of them, filling out grant applications. They're wasting their time and talent on paperwork when they're desperately needed on the front lines of the services that we want them to deliver. And that's inefficient. It's a waste of those people's incredible talents and skills, and we have to stop doing that. That came across very clearly in the inquest.
Here, I was cheering inside as you said that, Kirsten. I mean, I came from the nonprofit sector before coming to work at City Hall after being elected, but my heart is very much there, and I understand that struggle deeply. So Jade, over to you, your comments on what it would look like if we actually properly funded the services that we all need.
Thank you, Councillor. I know that all 3 of you have spoken at length about what is required and what's necessary. We all know that increased funding means increased capacity and less burnout, and it ensures that resources are available when folks need them, so that we're not turning people away. And at the end of the day, I think that's key. It means significant positive impact in local economies, addresses labor market shortages when people are supported to enter into the labor market, ensuring that both local economy and individual autonomy is available. At the end of the day, Band-Aid solutions will not work when systemic surgery is required. And with that, I'd like to welcome Melissa Summers back to the conversation. Melissa.
Thanks so much, Jade, Kirsten, Candace, and Ariel. I want to thank you for addressing kind of, we're just touching on these recommendations, right? Then, and I do want to remind everyone there's 86 of them, and they really span a breadth of I guess, opportunities for us all to figure out how to address the issue. I want to open it up for a brief Q&A. If I do see that there's a question in the chat, Councillor Troster, if you want to address that one from Inez. It's just regarding the pilot project. I'm going to let you read the top part, but I'll just speak to the bottom part of her question. If police are co-producing and enhancing the use of their mobile crisis response teams, how can we be sure it is completely police-free? Do you care to comment on that?
So this program is completely police-free. Some of the funding was hived off from police. Right now, there is no police officer that sits on the Guiding Council for Mental Health and Addictions. And when this service is just deployed, it will be entirely separate from police. It's completely a separate channel. The police do have their own mobile response teams where they do work with mental health nurses from the hospital, I believe. And that is separate. That is in addition to this service. But if you call this service, there will be absolutely no police involved. At one point, before I was elected and before my time, there was some representative from the Ottawa Police that sat on the Guiding Council for Mental Health and Addictions, and they left. They were asked to leave because the community wanted this service to function completely outside of policing. So some of the funding was actually hived over from policing. It was diverted. It was an example of detasking. But right now, I can assure you 100% there is no police involvement in the Guiding Council for Mental Health and Addictions. I'm not sure what the OPS wrote in their yearly budget report in that regard. I see there's a quote there, but that might have been referring to past involvement. It might have been referring to the funding that was moved over. But this is entirely a separate track, and it's a very similar model to what was followed and then scaled up in Toronto.
Thanks so much for addressing that. I'm going to put this one to all of our panelists, just from your perspective. Ray has asked, will there ever be real consequences for police officers that offend? In 2015, 40% of police admitted to beating their wives, and yet no arrests were made. How can we trust them until this is dealt with? Any comments on it? I know that that's a very direct question.
You know, I'm not familiar with that statistic, so without getting into perhaps the details of that particular point, what I think is really important for us to understand is that we should assume that intimate partner violence exists in relationships in every aspect of our society. That means in your workplaces. That means, you know, in our healthcare system. That means in our police services. That means in our school system. It is a mistake to assume that that is not the case. The evidence tells us otherwise. And, you know, obviously I don't know the data behind that specific statistic, but we know that that intimate partner violence exists across demographics, across income levels, across racial groups, across religious backgrounds. And so, you know, we should never be surprised. And yet we are, you know, there is, I talked about this before, that idea of like this violence that happens in the private sphere. And these ideas that still pervade our society around that framed our legal responses around what you can do, you know, the king of the castle doctrine, or what you can do in the privacy of your own home versus what you can do in other contexts. Those ideas, I mean, nobody would say that now, that's okay now, but those ideas have woven themselves through both our legal systems, our structures, and our mindsets. And so we have to unpack that. And so, you know, I think it's really important, whether it's sexual violence, whether it's intimate partner violence, we should never be surprised when this happens in a workplace, in our homes. And I know that some of you are joining today from in the context of your workplaces. I think there's a really interesting opportunity for conversation there about what does that look like when these when these collective social problems express themselves in the context of work. What does it mean when someone's partner shows up in the office clearly expressing like threats or generating fear? You know, that is a risk for the workplace. But obviously now you now see something that maybe otherwise you didn't see, in a way that you didn't see it? How does your workplace respond? What would you do? You know, what are you supposed to do? And you know, we unfortunately we have laws around this now because we did lose somebody in the context of intimate partner violence that manifested in a workplace, and it resulted in an inquest and recommendations and legal change. And so now there's obligations that grow from that. And so this idea that like this is something that happens to someone else somewhere else in this private way that we don't see is an idea that is not serving us well at all, and that actually we've been through trauma and through failure and through femicide, we've been pulled to a place where we have to tackle these things in the public sphere.
Yeah, and I just want to address some of the comments in chat and some of the things that came up. So I was approached by a number of you who work for intimate partner violence organizations about this terrible case right now. A police officer is back on the force after being convicted of intimate partner violence, which I think is completely unacceptable. But as Ray points out in the chat, first of all, yes, Ontario municipal law limits what we can do in terms of I can't bring a motion to City Council to detract from a police budget. I can simply vote against it, which I did last time, and I will do this time. And also the power of the police association and their collective agreement is incredibly powerful and very difficult to deal with. I'm going to be really honest there. They're going to protect their members. And so that's why it's so important to speak out. So I've said to those organizations, if you want to come and speak about this case at police board, I'm happy to help you make that deputation. I'm happy to make sure that your voice is heard. But there are some real legal obstacles to police reform in this country and in this province. And I think we need to recognize that. It is an institution that's self-sustaining. And there are very, very specific guardrails that are placed even on municipal council. So even though our municipal budget pays for policing, when they come to City Council, we can vote for or we can vote against. And just as someone said, Toronto had to apply for a special waiver to do it. So this is why I hold out hope over time for the detasking that might occur with the expansion of alternative service that is a completely different stream. The intention is to take unnecessary work off of police, which is work that they shouldn't be doing anyway and that they're not trained for. But there are, and we saw last term, obstacles to reform from a chief who tried to implement some reform initiatives and they faced major backlash. So policing is an institution that we have to contend with. And it is not an easy road, but I'm encouraged by all of you that are doing the work.
Thank you so much to both Kirsten and Ariel for commenting on that one specifically. And thank you for talking a little bit, Kirsten, about what we can all do in terms of recognizing that in all of our spaces or in all of our community spaces. And to you, Councillor, for talking about empowering people through deputations and using their voices. On that note, I do want to point out a couple of questions we have from two of our viewing experiences that kind of are similar, but both at BMO and RBC in terms of how an everyday person, I guess an average person who's not necessarily working in the sector can use their voice or how they might get involved in helping kind of advance some of the work around this issue. Maybe I can, Jade, would you mind commenting on that? And then I am going to come back to, because we're going to be closing out shortly and I do have an exciting video to share.
Thank you, Melissa. I was just popping into the chat because I wasn't sure if we had time. My comment to wrap up today's conversation, I come back to something I said at the beginning of today's discussion. We need to see it, name it, to change it. We need to continue to advocate and vote for policy change. We have an opportunity here to let those that have positions of power know that change needs to happen. If you're interested in learning more about potential opportunities for advocacy, I encourage everyone on the call today to take a look at Luke's Place that has developed an advocacy toolkit, which would be a great way into learning about how to continue to advocate on behalf of ensuring that these recommendations are implemented and that frontline social service providers are stably and adequately funded moving over. I just want to also say a big thank you to all of our panelists today for joining us for today's vital conversation. We really appreciate your time and your expertise. And of course, thank you to everyone for joining us on the call as well. Please take a look at the remainder of the 86 recommendations. It is a great roadmap towards creating the change that we need to see in our society. Of course, there are other opportunities to learn a little bit more too, including, as mentioned, the mass casualty report and the National Action Plan to End Violence Against Women and Girls, as well as missing and murdered Indigenous women and girls calls to action as well. I know that we've got a great video clip to share with folks, for those of you that are still on the call with us, which brings us back to 2 weeks ago when United Way East Ontario celebrated our annual Community Builder of the Year awards, where we were honoring and recognizing the significant decades of work and contributions that anti-violence sector network partners have been contributing to across the region of East Ontario. Melissa, hopefully that clip is available and ready for us to go.
Absolutely.
Thank you.
I just want to thank our panelists before we go to the video, actually, just for sharing your perspectives on some of these really crucial recommendations. And like you have touched on, Jade, these are just 4 of 86, and they're great to be looking at and to understand what's happening within all of our communities right across the region in supporting this work. I'm going to ask Deanna just to load up the video in this incredible, it's an incredible video, and I highly encourage anyone who's still on the call, and I think we have most of our attendees still on the call to stay on and watch, and then I will close this out just after the video. Thanks. Deanna?
We are seeing anyone on the front lines is that the level of violence is escalating. The number of victims and those being victimized are escalating. The intensity of the violence is escalating.
Juste au niveau des appels, on reçoit, au courant de la dernière année, on a reçu au-delà de 10 000 appels, que ce soit des appels de crise, des appels de soutien ou des appels de chat ou texte.
I think the critical moment happened and a wake-up call happened on September 22nd, 2015, when we lost 3 residents in Renfrew County. Then the inquest brought a lot of that back up to life, but now women are still dying at a rate of 1 a week.
The momentum since the 86 recommendations were released has certainly brought a focus on rural issues. It really, I think, heightened people's awareness of risk, of reality. Community is moving, and community is driving the momentum. They're tired of the level of violence. They're tired of the COVID realities in terms of exacerbating violence, and they're saying, yeah, we know what's happening. It is an epidemic. Let's call it what it is, and let's push.
When we think about gender-based violence in the unique moment that we're in, it's not just the immediate violence that a person is experiencing, but the ecosystems of care that have been deeply fragmented that are impacting access.
Le logement abordable, si on travaille sur au niveau du transport et tout ça, bien, tout ça a un impact positif justement sur la violence faite aux femmes. Souvent, la femme demeure avec son abuseur parce qu'elle n'a pas accès à un autre logement, parce qu'elle n'a pas accès à un auto pour se rendre au service.
The challenge is resources. The challenge is affordable and safe housing. So it's fine to say, I'm ready to go, but where do I go?
It's not just safety planning now, it's like, how do we keep you alive until we get you out? And that should not be happening in 2023.
Some of those systemic gaps really gnaw at you because it can feel like a wall where it's like, how do you begin to imagine a world where we don't have to be talking about survivors not having access to the things that they need to be able to thrive?
At the core of all of this are the survivors and also the folks who didn't make it through being victims of intimate partner violence. And those days when I get to witness the resilience of people, the resilience of families, the support that's available, that's amazing.
You never know when you have an interaction with somebody what that's going to mean for them, and it could be years later when you find out, but they'll come back to you and say, you planted the seed in me that, I do deserve better, and whatever that seed may be, right?
What always draws me back is being able to go into the shelter and hang out with the kids. See their faces, see the fact that they are safer and they are coming through this on the other side. That just gives me hope.
Our movement to end gender-based violence needs folks with all sorts of different skills. So start wherever feels good for you, and that can include having a conversation at the dinner table.
Go to an event. Go to Take Back the Night. Go visit the mosaics. Go check us out. All genders are impacted by violence and should be part of the solution.
Everyone has knowledge and experience, whether they realize it or not, and every voice is wanted and needed
Il faut sensibiliser, je pense, la communauté au fait que la violence faite aux femmes, ça existe dans notre région. Donc, tu sais, on veut que monsieur, madame, tout le monde soit à l'affût de ça, puis de faire attention, puis de porter une attention particulière à son voisin.
It breaks all the boundaries of, financial access or education. It can happen to absolutely anyone, and that's really important that we note and we get that message out, because anybody needs to feel free to call any of the services.
We have to find our courage somewhere to, when we see violence, to name violence, and then we can change violence.
De façon générale, il faut sensibiliser nos communautés, éduquer nos communautés, puis il faut faire de la prévention. Je pense que c'est là qu'est la clé.
We need to be educating at schools, and we need to be talking about violence. What does a healthy relationship look like? We need community to ask difficult questions of our politicians around what are you doing about housing? What are you doing about the lack of, mental health supports? What are you doing about the issues of intimate partner violence, and why are so many people dying?
All three levels have a role to play. This is a nonpartisan issue, right? Gender-based violence is a nonpartisan issue.
Collaboration is hugely important. I think we actually know more about the rates of violence because more people are coming forward and we're talking about it more and working collaboratively with the United Way, with our police services, with our community safety and well-being team.
It's not just, folks coming together and having conversations, but it's also talking about coordination around, okay, we know that we're dealing with an issue around housing. What are the strategic areas in which we can all kind of collectively advocate for changes?
En fait, l'ajout de Centraide à la table, je trouve ça très intéressant justement pour de connecter justement tout le réseau ou même à l'extérieur du réseau de la violence faite aux femmes, parce que la violence faite aux femmes, ça touche tout le monde.
It just feels like an essential piece to have United Way connected.
It's almost like a wrap around us of information that we otherwise would not have access to. And to know that somebody is sitting there at that table who genuinely wants to help you with as few hoops to jump through as possible, it is such a blessing.
Being honored by this award is a really beautiful pat on the back, because it is lonely work. We're kind of behind the scenes, and yes, every so often we have media attention, but nearly only when a tragedy occurs.
A lot of my family members don't know what I do day in and out because of the confidentiality, for one. And then people don't want to hear sad stuff, right? They want to hear what's going on in the world that's good, right? So I think for United Way to say, we recognize that you guys are doing this every day. You're in the trenches, you're doing the tough work, you're supporting women, you're keeping them alive, you're doing your best you can with what you have. That was monumental for me to say, that's okay. Somebody's recognizing the work we're doing, and wow.
It's a very proud moment, and I feel very proud for so many of the women who we've lost along the way or been taken from us, to be able to say, look at us. We're making a difference and people are recognizing it. And I really just appreciate that, and I appreciate that we've all come a long way.
It's not an award for us, it really is for the everyday advocate that has put their life and their hard work and dedication to making the world a space that gender-based violence is eradicated. So I'm deeply grateful and humbled to be part of such a movement and community.
I don't know that I'll ever tire of watching that video, and I want to thank you all for helping us celebrate our incredible Community Builder of the Year Award recipients. A final thank you to everyone for joining us today, for our amazing, impactful panelists, for having such an important conversation. Before we close out our event, I would love to welcome folks to just turn on their cameras so we can grab a few photos of this wonderful group and demonstrate our commitment to the conversation. Our team will be taking a photo. Deanna, I know that you're grabbing the shot, so I'll let you do that. I do want to remind everyone that this coming Sunday marks the first day of the 16 days of activism against gender-based violence. And I hope that you will carry the momentum that we feel today forward and join, as you heard in the video, this movement. You can dig in and find ways to influence the ongoing implementation of the 86 recommendations. You can share what you've learned today to shine a light on intimate partner violence. You can talk to your community about what we need to make our community safer for women, and you can support gender-based violence services. And of course, you can join Women United. Together, Women United, just to understand what we are, we're tackling more than just addressing gender-based violence, but we're making a difference where we live. We're learning and we're advocating for change, and we're hoping to create a brighter future for women and girls. We have a brand new website that I know we're going to pop a link in the chat, but there you can read a little bit more about what we do, some of our past events. The incredible Disruptive Dialogues are one of my favorites, and learn about how our donors and the individuals involved with Women United are helping to make an impact right across our region. I want to say a final thank you to everyone again, and have a wonderful day.